You have bipolar disorder.
Are you out of your mind?
You urgently need treatment for heart disease. But how? Administer enemas 3 times a day. But I have bowel cancer. It's all because of appendicitis.
What should I do now?
Syphilis requires immediate treatment. Advanced stage.
Paranoia, epilepsy, syphilis, and atherosclerosis. The health issues of the Kremlin's elite were the biggest secret of the Soviet era. Simultaneously, these diseases turned into lethal weapons in political maneuvers. They battled for power ruthlessly and deliberately. And the main advantage in this struggle was not power or influence. The main advantage was the best and most potent medicine in the Kremlin's arsenal. For the first time, the secrets of Kremlin's medicine, the mythical syphilis of Lenin. This allowed Joseph Stalin to rise to power. Medications were utilized by doctors to extend Ilych's life.
At a certain point, Lenin was completely powerless to oppose any of Stalin's decisions.
Mysterious deaths at the Kremlin hospital. Mikhail Frunze, a commander of the Red Army under the command of Joseph Stalin, died on the operating table. This occurred by the directive of the Secretary General.
The addiction specialist quadrupled the dose of ether, and he exceeded the chloroform dosage by 1.5 times. Indeed, this implied that Frunze's tragic demise was absolutely inevitable.
The Kremlin's prison cells were used for political repression. Mikhail Kalinin, the chairman of the Presidium, received enemas for intestinal cancer, and Zhdanov underwent innovative heart treatment. Secrets of the death of Stalin's successor.
He suffered a heart attack, but the Kremlin doctors failed to diagnose it. He was treated for asthma, and after a second heart attack, he passed away.
It was a time of significant medical advancements, a period of power and influence. These were also games where an innocent analysis of the Kremlin's elites could result in a death sentence for them. October 1925. Moscow. A man was being wheeled down the hospital corridor on a stretcher. This is Mikhail Frunze, the People's Commissar for Military and Naval Affairs, an influential and commanding army chief. He was one step away from becoming part of the country's top leadership. And now this unfortunate incident. His wife, Sophia, could not find a place to sit due to her excitement. They had just gotten married. Now she was anxiously waiting in the waiting room, biting her lips until they bled. She wanted to make sure he was okay and that he would get better. But Frunze himself was completely calm. It was supposed to be a minor operation. The only thing that upset the People's Commissar was his own carelessness. Why did he drink so much? If he had controlled himself, the ulcer would not have burst. September 1925, Moscow. This toast was not to be missed. The humble Frunze emptied his glass with a tight smile. That's it, the last drink for today. He will not drink anymore. But toasts for the Secretary General's health followed one after another. They were delivered by his faithful friend and comrade in arms, Kliment Voroshilov. Throughout the evening, he ensured that his friend's glass was always filled to the brim. Frunze didn't notice anything suspicious in his friend's behavior. Indeed, the heightened attention from a battle-bound comrade was not coincidental. In recent years, Voroshilov and Frunze have been practically inseparable,
Hunting, fishing, and frequent trips to the countryside were all accompanied by abundant feasts. The routine also included obligatory alcohol consumption, which was strictly prohibited for a patient with a Frunze ulcer.
Vyacheslav was well aware of this. Soon after the extravagant banquets, Mikhail Frunze experienced a worsening of his illness, and Vyacheslav was not left helpless. 15 minutes later, an ambulance from the Kremlin arrived. Frunze was taken to the surgery room, and Vyacheslav vanished. He fulfilled his role in the game. The future outcome of the operation depended on the doctors.
Prepare anesthesia.
Frunze knew that the surgery could have been avoided. He agreed to the surgery only on the condition that the doctors promised to get him back on his feet quickly. This became a decisive factor. The People's Commissar did not want to stay in bed. He did not want to ruin the much-anticipated vacation that he and his wife had planned in this manner. Sofia had long yearned to depart from Kyiv. The doctors assured that after the surgery, Frunze would be able to walk. The doctor was preparing the anesthesia when an agitated assistant burst into the operating room. An urgent call from the Kremlin.
I'm listening. Yes, yes.
What?
I understood everything.
When the doctor came back, Frunze was still conscious. The 40 grams of air given to the People's Commissar did not have any effect. The doctor tripled the dose. And yet there was still no effect.
It's okay, give me chloroform. I meant chloroform.
Everyone in the operating room knew that combining these medications, particularly in such doses, is extremely dangerous.
Chloroform has been known since the beginning of the 19th century. This is the most poisonous drug. It causes many different complications. These complications include heart rhythm abnormalities and cardiac arrest. The pharmacologists kindly explained that the use of chloroform is very dangerous, especially if this medication leaks excessively onto the mask. Furthermore, both pharmacologists and surgeons asserted that the combined usage of ether and chloroform led to particularly severe complications.
However, the doctors administered to Frunze a dose of chloroform that was 1.5 times the recommended amount. They had no other choice, because their own lives were at stake. Eventually, Frunze's heart failed during the operation. Attempts to revive cardiac activity were unsuccessful. Frunze passed away at 5:30 in the morning. He was only 40 years old.
A thorough examination of all accessible data revealed it turned out that no operation was needed. The surgeons were only able to open the abdominal cavity, perform an examination of the abdominal organs. These are, so to say, the initial stages, and cross several intersections. After that, as his heart rate appeared to begin decreasing, they had to immediately halt the operation. I had to quickly stitch up the surgical wound. After that, he underwent procedures that were later referred to as resuscitation.
Stalin was victorious. Everything went great. Now no one will be able to suspect that Frunze's death was not accidental.
We can only talk about one thing. Stalin insisted on conducting operations. Even when Dr. Rozanov, the Kremlin's chief surgeon, had serious doubts about its necessity. For some reason, he was very reluctant to undergo the surgery.
It was Stalin who, upon learning about Frunze's illness, ordered Vyacheslav to assist his associate. He took on the task with enthusiasm. After Frunze's death, he pledged to appoint Vyacheslav as the army commander. Stalin's first priority was to remove Frunze. The People's Commissar was too influential, too young, and too popular among the people. He was adored by the military and the Politburo. And it was he, not Stalin, who was referred to as the successor of the late Lenin. If Frunze had wanted to, he could have easily ousted the leader from the position of general secretary, but Stalin wouldn't allow that. Frunze could not be arrested or executed. The assassination of the commander-in-chief would have incited popular anger and indignation among influential party members. He needed a reliable, tested weapon. A weapon created by his predecessor, Vladimir Lenin. Nevronsine 23, Gorky. He leaned against the bathroom door with his entire body and held his breath. Only here did Lenin feel secure. He knew that there was turmoil in the mountainous country. They are looking for him. But no, there's no way he's getting out of here. They persistently knocked on the door, but Lenin resisted with all his might. He could not tolerate this abuse any longer. He was forcibly administered the most potent chemicals for a long time. He was forcibly injected with arsenic. He was compelled to take mercury pills to treat alleged syphilis. Lenin attempted to resist, but they continued to treat him until he passed away.
The prisoner of the Kremlin, that's how Vladimir Ilyich Lenin was referred to in the Western press. Indeed, the conditions of his life at his country house in the mountains were akin to a prison. He was prohibited from receiving visitors, reading newspapers, and using the telephone. All that Lenin was permitted to do was to take numerous medications, which were consistently and punctually delivered to him by doctors.
Ilyich didn't give up until the very end. Because, like no one else, he knew that such attention was not due to concern for his health.
At a certain point, Lenin found himself utterly incapable of opposing any of Stalin's decisions. Even though he penned this renowned letter to Congress, attempting to convey a different message, his powerless condition was such that he couldn't truly impact anything.
Dear Felix, I believe that everything that has happened to me is the work of Stalin and all those who are allied with him. I was actually isolated from the party and society. I believe I might be poisoned or harmed. What should I do? This letter was only declassified in 2009. Lenin covertly handed it over to the country's first Chekist, Felix Dzerzhinsky, through one of his secretaries. However, the letter was never made public. He reached Joseph Stalin, and Lenin's fate was sealed. A month later, the leader of the revolution passed away. The hospital in the Kremlin, established by Lenin, fell under Stalin's control. Under his guidance, it became a division of Lubyanka. It was the 1930s. Stalin had just started to consolidate his power. The leader was well aware that there were many more enemies around him. He has to deal with all of them. Sufficient incriminating evidence was found on Ilyich Zinoviev's former associates, including Kamenev, to execute them as part of the political repressions of that era. Serhiy Kirov, the leader of the Leningrad Regional Party Committee, who opposed Stalin's nomination, was impersonated. According to the official version, he was killed by a terrorist's gunshot. Indeed, Kirov's assassination was orchestrated in the Kremlin. Others were more challenging. His arch-nemesis Leon Trotsky was in hiding overseas. Others were around, but they were not so easy to interact with. During his 8-year tenure, the head of the OGPU, Vyacheslav Menjinsky, mastered the art of not leaving traces of crime. If they had been, Menjinsky would have been able to reveal much more about his collaboration with Stalin during the interrogation. The situation was similar with Mikhail Kalinin. The former associate of Lenin and chairman of the Presidium had crucial information to reveal to the investigation. These people should have been handled more carefully. And Stalin had a revelation. Doctors. Once upon a time, they assisted in the matters concerning Frunze and Lenin. It was a perfect subtle move. Eliminate them one by one, subtly and quietly, so that their demise does not raise suspicion. There was no better remedy. May 10, 1934, the Kremlin, 10:15 in the morning. A tense silence prevailed in the Politburo hall. 15 minutes ago, an important meeting convened by Stalin was supposed to start. Party members have been grappling in the field for an extended period. There was also a leader here. He looked indignantly at the empty chair. After the general secretary, the head of the OGPU, Vyacheslav Menjinsky, was scheduled to deliver a welcome speech at the meeting, but he was not in the hall.
Is it all right, comrades, if we wait a little longer?
His words, his movements, nothing revealed his inner turmoil. Stalin was prepared to wait as long as required because everything hinged on his patience. May 10, 1934, at Gorky 6, 10:20 in the morning. He was panting, inhaling air through his mouth, wheezing and convulsing. Vyacheslav Menjinsky could not even reach the phone to call the Kremlin. He knew that he had been expected at the meeting 20 minutes ago. Just yesterday, the head of the OGPU was confident that he would display full strength and energy. However, Menjinsky's plans were thwarted by a sudden asthma attack. He was frantic, gripping the hand of his close friend and sole assistant, Dr. Kazakov. He was always by his side, treating him for this disease for many years. However, the treatment did not help. Before losing consciousness, Menjinsky shifted his intense, frantic gaze to the clock. It was 10:30. May 10, 1934, the Kremlin, 10:30 in the morning. Stalin turned his attention to the members of the Politburo. He saw his fellow party members whispering in fear. Of course, the Kremlin was aware of Menjinsky's poor health. The OGPU head had long been plagued by health problems, including kidney issues and asthma. Due to his prolonged and chronic illness, Menjinsky was constantly under medical supervision. However, he was an extremely responsible individual and never missed a Politburo meeting. Never until now. Half an hour passed, and Menjinsky did not show up. Finally, a scared secretary appeared in the room.
Comrades! Information has just been received. Comrade Menjinsky has passed away.
The news about the death of Vyacheslav Menjinsky deeply moved those present. No one noticed the relief that flashed across the leader's face for a split second. Stalin was satisfied. The plan worked flawlessly.
Indeed, the OGPU during the 30s was akin to a state, implying it had the power to control everything and everyone. Therefore, if such a structure is managed by the wrong person, then of course it would likely be disadvantageous, primarily to Stalin. It's hard to determine whether Menzinsky was entirely a Trotskyist. However, it is undeniable that he was not entirely subordinate to Stalin.
From the moment the leader first suspected Menzinsky of treason, he began to closely monitor his subordinates' activities. It was not difficult. Dr. Kazakov regularly updated the leader on the progress of the treatment. For several months, the doctor had been incorporating a foxglove plant extract into Menzinsky's concoction. This poison killed slowly and imperceptibly, much like the asthma that had afflicted the head of the OGPU for many years.
If a person has pneumonia, the treatment procedure should be carried out in such a way as to alleviate this pneumonia. Consequently, there was no suspicion that anything was wrong. It was simply a single complication. As we start treating one complication, another arises. When we address that, a third one occurs, and eventually, it results in death.
With his hand on his heart, Stalin stepped out into the corridor. He felt unwell. The blood was pulsating rapidly in his temples. However, the cause of this was not the death of the country's chief Chekist, but Stalin's own ailing heart. Joseph Vissarionovich was starting to lose his footing. Yes, the Secretary General was fully aware of his subordinates' health conditions, but the leader carefully concealed his own illnesses. 1927, the Kremlin.
You are paranoid.
The Secretary General's face remained impassive. He looked into the eyes of academician Bekhterev. He will now recognize his error and apologize for the incorrect and irrational diagnosis. Perhaps he will be forgiven. But Bekhterev remained silent. Famous psychiatrist, professor. Of course, he could not be wrong. But this righteousness cost him his life. Bekhterev will pass away this evening. Stalin would never visit the doctor again, despite the numerous illnesses that plagued him throughout his life.
Contrary to the common stereotype of the leader's robust health, Stalin suffered from numerous illnesses. As a child, he contracted smallpox and severely injured his hand. Therefore, he was unable to lift anything heavier than a smoking pipe with his left hand. Later, while in exile, the leader suffered from joint rheumatism. This issue was exacerbated by severe outbreaks of influenza and sore throat. He suffered from stomach disorders. He suffered from headaches, psoriasis, and high blood pressure.
There were always doctors nearby who could help. However, Stalin did not wish to address them. He was all too familiar with the intricacies of medical games, which he himself had initiated. And now he was most afraid that he himself would become a pawn in this game.
Stalin was scared of doctors. He was scared and distrustful. There were rumors in the Kremlin that Stalin did not like to be treated. In essence, Stalin attempted to disregard any minor ailments such as sneezing or colds, to evade medical treatment. Essentially, he avoided doctors' appointments. However, he probably believed that when he orchestrated the murders through doctors, there were people capable of directing doctors towards him.
He knew how to take care of himself. Breathing is steady, pulse is slightly elevated. Slowly and methodically, checking his watch occasionally, he dug into the ground in the Kremlin yard. The leader performed such physical exercises every morning. Stalin never skipped this exercise, as it was his way of maintaining good health. Stalin chose the same plot of land every day. Knowing this, the guards patrolled the leader's favorite area in the evening, so that the ground is firm enough to dig the next day. Exercise was only a part of the leader's health program. When assistance was not provided, heavy artillery was used. Folk recipes clipped by the leader from magazines and newspapers.
Thanks to them, Stalin learned that juice from parsley and raw potatoes should be consumed for high blood pressure. Psoriasis should be treated with an ointment made of celandine and petroleum jelly. The leader frequently treated sore throats with lemons. He ate them with the skin on. However, none of the recipes spared the leader from heartache, which became increasingly frequent.
And now he felt a familiar pain in his chest. Stalin had a hard time leaving the meeting room. All the better. The news of Menjinsky's death would distract the members of the Politburo. This means that no one will notice if the leader's performance suddenly declines. My legs and arms felt like jelly and did not respond. His heart felt like it was going to jump out of his chest.
Comrade Stalin, should I call for a doctor?
Are you out of your mind? Go away. Go away.
Stalin could not allow others to find out about his illness. Although it was these diseases that led to the leader's subsequent medical issues. He ousted Lenin and Frunze to establish himself in power. Now the leader was afraid that no one would be able to usurp this power. As a result of his increasing paranoia, he saw enemies everywhere. The adversaries were once allies and members of the Politburo. One of them, Vyacheslav Menjinsky, can finally be removed from the list. The next issue was as follows. A case that has troubled him for years and has long become personal. At second place on the list is Leon Trotsky. 1938, Paris. Lev Sedov did not feel tired. He wanted to finish his father's manuscript as soon as possible. For several months, he and Trotsky collaborated on an authentic biography of Stalin.
The book was expected to be a sensation. Secrets of Stalin's crimes, the assassination of Lenin and Zinoviev, and the final testament of the leader. Leon Trotsky was about to disclose this information for the first time, the only thing that slowed down the work. Due to the persecution by the Chekists, Trotsky was compelled to continually change his place of residence, conceal himself, and flee. Hence, his son occasionally had to wait several months for priceless manuscripts handed over by custodians.
And now he has finally received the final chapter. This means that the publishing house will release the printed version of the book in a few weeks. And then the entire world will discover the truth about Joseph Stalin's actions. The individual who made Leon Trotsky's life miserable and who was closely monitoring his son at that moment. 1938, the Kremlin. Stalin yelled and struggled in a rage. Addressing Lavrenti Beria, he did not mince his words. For many years, the country's top intelligence agents were unable to identify and neutralize Lev Trotsky. If his book gets published, Beria will take personal responsibility. The chief of the NKVD didn't even flinch. He was prepared for this meeting and was able to withstand the pressure from the leader. 1938, Paris. The young man was taken to a small clinic in the city center. He urgently needed to have his appendix removed. Lev Zhdanov was furious. Why did the attack occur now, just when the book was nearly finished? Zhdanov was in a rush, yet the doctors assured him that the operation was minor, but it could not be delayed.
The operation was successful. Parisian doctors successfully treated appendicitis without any complications. But on the fourth day following the surgery, the patient's health suddenly worsened. Later, it was revealed that during the surgery, doctors administered an ampule of potassium cyanide to Zhdanov. A few days later, the ampule broke, and Zhdanov died. He was only 32 years old.
The brilliant plan of the Soviet leader worked. Before ordering the execution of Trotsky, he will command the elimination of all his children. Lev Zhdanov was discreetly and imperceptibly eliminated. The book was never published. And Stalin, satisfied with the outcome of Trotsky's case, moved on to the next name on the death row list. 1945, the Kremlin. On this day, the Politburo meeting sparked heated discussions. The case of generals found guilty of power abuse was reviewed. However, Stalin did not heed this. He carefully observed the speaker, the lively and enthusiastic chairman of the Presidium of the Supreme Soviet, Mikhail Kalinin.
The gentle and submissive head of the Presidium was a dutiful puppet of Stalin for many years. He signed all the directives of the Politburo. In this way, he actually took responsibility for what he had done. But lately, he has started behaving inappropriately. He argued and refused to sign some documents. Under Stalin, no one could afford this.
The General Secretary has already punished him once. He sent Kalinin's wife to Siberian camps for several years. But it seems that the lesson was never learned. Stalin understood that he could no longer procrastinate and wait. Kalinin was highly esteemed in the Politburo. He was recognized on the streets. This popularity and lack of control could prove too costly for Stalin. 1946, Kremlin Hospital.
Administer enemas 3 times a day. I have colon cancer.
Mikhail Kalinin cried like a child. For over a year, he took enemas and pills for gastritis as prescribed by his doctor. But it didn't help. Terrible pain tormented him more and more frequently. And only now the doctors were able to give him an accurate diagnosis. Intestinal cancer. Where did this terrible disease originate? Recently, he was assured at the same hospital that he is completely healthy.
Kalinin was unaware that he had signed his own death warrant a year earlier when he had the audacity to contradict Stalin. In his case, the leader resorted to the tried and tested method, albeit with a minor modification. This time, the Kremlin doctors did not fabricate imaginary diseases. They simply didn't inform the patient about the actual illness.
In 1929, doctors performed the same procedure on Lenin's wife, Nadezhda Krupskaya. At the age of 69, she became active, participating in rallies and openly criticizing Stalin's policies. However, this proved to be dangerous, and she paid a heavy price for it.
Indeed, Krupska was treated by the same Kremlin doctors in 1939, 2 days before her 70th birthday. She arranged a reunion with old friends, former Bolsheviks. She prepared a large number of dumplings for the entire group of guests, about 30 people. And after that party, she felt sick. Her stomach started to hurt. Doctors at the Kremlin initially diagnosed her with food poisoning. They treated her for food poisoning, but she eventually developed appendicitis.
Doctors did the same to Mikhail Kalinin. A year ago, when he was first admitted to the hospital, he could still have been saved. But now there was no hope. The cancer metastasized to the liver and lungs. It was too late.
He served a representative role, so to speak. He completely concealed Stalin's activities. Stalin gave orders, issued directives, and Kalinin implemented all of it through the Presidium of the Supreme Soviet. They enacted collectivization laws. Laws regarding the theft of socialist property and related matters. Stalin merely utilized it. When it became of no use to Stalin, he simply discarded it.
After Kalinin's death, Stalin abolished the position of the chairman of the council. He won't make the same mistake again. He will not entrust this position to anyone. Ever since then, he viewed even the slightest mistake made by the members of the Politburo as an act of treason. With Kalinin's death, the list of those condemned to death will be filled with new names. However, seeing conspiracies everywhere, Stalin would perceive a masterful game. In this game, he will be a brilliant but helpless pawn. August 1948, Government Summer House in Valdai. Andrei Zhdanov, a member of the Politburo and secretary of the Central Committee, was lying on the floor of his office. He writhed in excruciating pain. He was well aware of his illness and therefore brought a team of doctors with him, even on a short vacation. He had been calling them for several minutes. Zhdanov's condition was deteriorating, but there were no doctors available. Zhdanov was unaware that waiting for help this time would be futile. And his closest friend and ally, Joseph Stalin, is to blame for this. February 1948, the Kremlin. This evening, the leader had more fun than ever. He presented the birthday boy with a large bouquet of flowers and even permitted himself to overindulge in drinking. Zhdanov was happy. Not everyone merits such attention from the manager. Stalin flushed from wine. He rose to make a toast. Everyone at the table fell silent.
Let's drink tonight. To the health of my friend, my successor. Andrei Zhdanov.
Zhdanov froze. No one uttered a word. For the first time, Stalin openly named the next general secretary. And he did it in the presence of the country's foremost figures, Khrushchev and Malenkov. No one expected this from the leader. Everyone toasted to Comrade Zhdanov's health.
But from that moment forward, as if by a cruel twist of fate, Zhdanov was tragically plagued with health issues.
He lay on the cold floor for more than an hour, screaming and throwing a tantrum. He was unaware that all this time a team of doctors was eavesdropping outside the door. When he stopped breathing, the phone in the Kremlin rang. August 1948, the Kremlin.
How is Comrade Zhdanov's health? He died.
Lavrenti Beria hung up the phone and looked meaningfully at Khrushchev and Malenkov. That's it. The job is done. They managed to peacefully remove Stalin's future successor to the position of General Secretary and their main rival for power. This was achieved through the leader's potent instrument, the Kremlin's tactic.
Malenkov, Beria, and Khrushchev carefully examined Zhdanov's case for a long time and soon discovered a vulnerability. It turns out that the member of the Politburo had a heart condition. Then it was a matter of minor details. It was crucial to determine when Zhdanov would take his vacation, accompanied by his doctors. The plan was to induce a heart attack and then simply wait.
As it turned out, all this time doctors had been treating Zhdanov's heart condition with asthma medication. The truth was only revealed after his death.
The truth is, he suffered a heart attack, but the Kremlin doctors failed to diagnose the heart attack, instead treating him for asthma. After suffering another heart attack, he passed away. Then one of the doctors who conducted the electrocardiogram, Lydia Timoshchuk, wrote a report stating that Zhdanov had suffered a heart attack. Other doctors didn't heed her, and following Zhdanov's demise, they endeavored to discredit her assertions and diagnosis to vindicate their treatment approaches.
1948, the Kremlin. Stalin could not find a place for himself. For the first time in years, he was scared to death. But how could this happen? The leader did not issue orders for this. This only meant one thing: he was betrayed. Joseph Stalin was now in a state of desperate fear for his own life. And for a good reason. A few years will pass, and the leader himself will fall victim to the method of medical treatment he invented. He will pass away at his country house. Hemorrhage in the brain, that was the official cause of his death. Stalin spent the last hours of his life surrounded by the people he feared so much, the Kremlin doctors.
His successor in office, Nikita Khrushchev, will carry on the leader's work. However, with him, the Kremlin's political maneuvers are extending beyond domestic boundaries. Eliminated spies and enemies of the state, traitors and informants. Many of the emigrants will become victims of miracle drugs created by Soviet doctors.
In the Kremlin itself, there will be a brief period of medical tranquility. Khrushchev was known for his robust health, and he preferred to address all issues through force, not through intrigue. He was never a subtle player, and he vanquished his enemies with straightforward arrests. The medical games in the Kremlin only resumed with the arrival of Leonid Brezhnev, but the rules of these games were changed forever. Brezhnev relied heavily on sleeping pills, which led to his dependency on them. General Secretary Andropov, due to kidney disease, spent 15 months of his tenure in the hospital undergoing hemodialysis. After his passing, the Kremlin's VIP quarters were taken over by the asthmatic Chernenko. Now they were just pawns in the grand scheme of things. The main stake of the game was not politics and power, but their very lives.